Finance Minister Joe Oliver stuck with tradition and got a new pair of shoes the day before he will stand in the House of Commons and deliver a new budget. His choice of new footwear, a pair of New Balance runners. That could be read as a nod to his stated plan to deliver a balanced budget, and perhaps that this budget will be the platform on which the government will run in the next election. One of several new items from tomorrow's budget is expanded childcare support from Ottawa. Parents of children under the age of 6 will get an extra $60 per month in support. In addition, Ottawa is creating a new monthly payment of $60 for each child between the ages of 6 and 17. The plan hasn't been without critics. There's no restriction on how parents choose to spend that money. When Conservative leader Stephen Harper proposed a similar plan back in the 2005 election campaign, a Liberal strategist explained the perceived flaw.
Don't give people $25 a day to blow on beer and popcorn. Give them childcare spaces that work.
The perception that parents don't spend extra benefits directly on children's needs has obvious opposition. A study from the Rotman School of Management found childcare support to families, particularly low-income ones, go right to basic needs. It states direct financial support can improve children's performance in school, the mental health of both child and parent, and even physical health in kids. It also found that, contrary to popular belief, families that get increased support significantly cut back spending on alcohol and tobacco. Lauren Jones is a co-author of the report and a postdoc fellow at the Martin Prosperity Institute. Great to have you with us.
Thanks, Amanda.
So let's start with kind of what you found. In a headline way, I would say, okay, we're giving more money to families. I guess it makes sense that that would improve outcomes generally. But there was controversy about this. Were you surprised by what you found?
I certainly was surprised, and I think you touched on one of the outcomes that was the most surprising, the fact that when we give some families increased benefit funding, they actually decrease their spending on alcohol and tobacco, which of course is a counterintuitive finding. We don't expect that we'll give people more money and it'll make them spend less in certain spending categories. But I think more broadly, we're less surprised the fact that families can be trusted to spend benefit income on the things that we would hope they spend it on.
So we found, and we talk often in this country about the number of kids who live, like 1 in 7, I think, kids don't have enough to eat, stable food supply, things like that. The findings here suggest that if you give somebody, a family, a low-income family, $60 extra a month, they're going to use it at the grocery store. Is that can we make a straight line conclusion like that?
I don't think we can make a straight line conclusion like that. Certainly, there's a big income impact of income on how families are going to spend the money,
right.
Of course. So low-income families, yes, we do find that they're spending more on food at grocery stores. But of course, the more money we give a family, there could be a threshold point at which they're no longer going to need to spend any more money at the grocery store. At that point, they might be diverting into other places. However, our findings show that they're not going to be diverting it into, let's say, beer, as your clip earlier suggested. It seems like they're diverting it more into areas like education investment.
And this may be kind of just speculative on my part, but is it fair, when I see that, I kind of conclude, or surmise at least, that stressed out parents who, the most stressful thing that I can imagine as a parent is not being able to care for your kids. So if you don't have enough food, for instance, I would imagine a pretty high level of stress. You might actually make a bad choice, like a pack of cigarettes, because it helps relieve your stress. Does this actually suggest that when you take away the stress of kind of basic necessities, that some of those harmful behaviors actually reduce for that reason? Is it the stress that is being taken out of the equation?
Yeah, I mean, in our study, our research design, we're not sort of able to, identify the exact mechanisms by which families are reducing spending on these so-called risky categories. Yeah. I think that is a pretty safe assumption. Other research in the U.S. context has found similar findings among expectant mothers, for example. There's a second mechanism through which families could be reducing spending in those categories, though, and that's kind of more of a time use mechanism. So when you give a family more benefit income, they could be using that to, say, go to the movies, buy some popcorn, and that's going to cause them to reduce the spending they're doing on alcohol, let's say, because they're not going to be spending as much time at home or in a licensed establishment.
We've seen the debate around this, and you saw sort of like a little microcosm of it, right? You could either create a daycare space or you could give money directly to parents. This tends to become kind of politically charged, but were you trying to sort of establish just basic outcomes here so that we can take some of the politics, the ideological aspect out of of this?
Yeah, definitely. I mean, as researchers, my co-authors and I, that's sort of our main hope for this, that we'll be able to sort of provide information that can inform the debate without sort of falling on one side or the other of the political argument.
And does this, is there other research like this anywhere in the world that you know about? I mean, does this kind of stand up with kind of what people have found in other kind of social democratic nations?
Yep. So the sort of best comparison, I think, is in the United States, where their largest tax benefit program has been shown to have great impacts for families. And in terms of the spending responses in particular, other researchers have found increased spending on things like healthy foods, fruits and vegetables, and also on certain sort of durable investment goods like a new car or something like that. The difference being that in the U.S., the sort of Similar benefit program, the money is delivered in one lump sum check once a year. And so in Canada, we kind of have a different approach where we're sort of dividing the money up equally into monthly payments. So we see slightly different responses in that regard, but I think...
What kind of responses? I mean, is there a better way to do it, the single lump sum or paying it out over time?
Yeah, I mean, I think the argument for giving it the money as a lump sum is that it sort of acts as a forced saving mechanism for families who might not be able to sort of save for large items like a new car or something like that. The downside to that, of course, is that if families aren't able to meet their everyday expenditure, when you're asking them to wait until March till they get their tax benefit refund, what are they supposed to do in the meantime? Yeah. The concern that would be that they'd be taking on high-cost debt in order to finance their everyday expenditures. So in Canada, we're not sort of putting people in that position, but at the same time, we potentially are losing out on the forced saving mechanism aspect of the policy.
All right, it's really fascinating. Thanks for being here, Lauren.
Thanks you so much for having me.
Lauren Jones.